momentum. To that end, Denver's Emergency Operations Center has been deactivated, and city duties related to vaccine distribution and coordination will transition to the Denver Department of Public Health and Environment. I want to thank our emergency management staff, as well as staff from multiple departments who for the last several months have been working every day in the EOC to get shots in the arms of as many people as possible. Now, deactivating the EOC does not, however, mean that our response to this pandemic is over. There's still a lot of work to be done and thousands more people to get vaccinated. We're winning both the game, but it's not over. It's not time to declare victory. Vaccine resistance and vaccine hesitancy, particularly in our communities of color and among young adults and older white males, is a troubling trend across the country. This includes people who've gotten their first dose, but for whatever reason are failing to get a second dose. Please don't delay getting your vaccine any longer. It's never been easier. Sites across the city are now offering walk-up, non-appointment needed vaccinations. This is your way. Now, let me say this very clearly. This is your way of telling your family, neighbors, and community that you care about doing your part to end the pandemic. And if you're getting one of the 2-dose vaccines, don't call it good and neglect to get your second dose. Maximum effectiveness of these vaccines and protection from this virus only come after you've gotten 2 doses of either the Pfizer or Moderna. Now, if you don't get your second dose, you're leaving the door open to COVID, not just to yourself, but again, to your family and to others in the city. Now, as I pointed out earlier, 63% of the residents 16 and older have received at least 1 dose. That's only about half of our total population here in Denver. So I'm going to issue a challenge to Denver residents so we can do our part to meet the new goal set by President Biden of getting 70% of American adults vaccinated with at least 1 dose by July 4th. Let's show this country, our country, how it's done by getting 60% of all Denver residents vaccinated with at least 1 dose by June 1st, and of course meeting the 70% goal by July 1st. If the FDA authorizes the Pfizer vaccine for 12 to 15-year-olds next week, that will definitely help us hit those targets. So join with me. Accept this challenge. Everyone who gets their vaccine is 1 step closer. We all get 1 step closer to having more folks being able to sit in a restaurant or go to the gym or attend gatherings with family and friends. Our economic recovery, first and foremost, depends on our public health recovery, and that's achieved through more people getting vaccinated. More people getting vaccinated means more of our local businesses can reopen further, and that means they can start getting more people back to work. We're getting closer and closer to the end, and until then, please mask up, social distance, get your vaccine as soon as possible if you haven't, and stay safe. With that, of course, I'm going to turn it over to Bob McDonald. Bob will outline changes we're making to our face covering public health order. We will be aligning pretty closely to the state's new mask order that took effect earlier this week. Bob?
Thank you, Mayor. Before I go into some updates, I just, as a public health administrator for the city, I also want to extend my appreciation to every business manager, everyone in the business community, every individual who have complied with our public health orders from the beginning. A huge thanks to everyone who's already stepped up to get vaccinated. It is making a difference. We're pulling out of this, and I feel good about where we are. Let's dive into an update on where we stand as a state, and then we'll dive into some Denver data. You can see here across the state that there's some variation with the levels, case levels throughout from county to county. Denver is still technically in what was historically referred to as the yellow phase of the dial, although the dial is devolved now to more local public health orders. but our numbers are going down, and I feel good about that. Let's take a look at the next slide here. You can see, and everyone has seen this is the epi curve from the beginning of the pandemic. You can see that huge spike that we saw in November and how that is drastically dropped going into the spring, and then a slight uptick there as we move through February and March, and now it's trending down again. That is largely due to people getting vaccinated. And I'll show in a few slides here what a difference that makes when you look at the work that Denver's done compared to other areas. The next slide, please. You can take a look at, and we're going to be watching this closely, as we do ease up restrictions here in Denver, you can see that as a state, we are second in terms of the number of cases of COVID we're still seeing. Huge outbreak happening in Michigan, and we still see some outbreaks here throughout the state. And we have a few here in Denver that we're working to control. So we're going to keep an eye closely on this, but overall things are looking better and better every day as more people get vaccinated. On the next slide here, you can take a look at another metric that we watch very closely, and that's positivity rate. In Denver, it is well below 5, which is where we want to keep it. Surrounding communities, it's slightly higher, and you can see in some areas throughout the country it's much, much higher, and in some states it's a little bit lower, but we feel good about where our positivity rate is. Testing is not out of the equation here. If you feel you're symptomatic, you've not been vaccinated yet, please get tested. And if you're positive, quarantine. That's what keeps cases from spreading. Next slide, please. The one metric that I think is even more important, and maybe the most important metric throughout the pandemic, is what do hospitalizations look like? What do hospital admissions look like? We are seeing an uptick in that, which seems counterintuitive because in the beginning we saw an older population that was more susceptible to harsh impacts of the virus. Now it's a younger demographic. Why is that happening? Because the variants that are now taking hold in our community have more severe impacts. So if you thought early on you're a young, healthy adult, you don't have to worry about the impacts of COVID-19, you need to worry about this. This virus has attacked people of all age groups. There have been deaths in all age groups, including very young adults. Next slide, please. We're doing very well here in Denver, as the mayor mentioned, trending ahead of the state and ahead of the country. But we need to push here towards the end of the pandemic here. Let's get out, get vaccinated. That's what it's going to keep driving our numbers down and keep this virus from mutating even more. Next slide, please. This says it all. You know, you see the trend, you see that downward curve on the x-axis there. You'll see that Denver is right up in front there with the number of people being vaccinated in our community. And look at our case rate, much lower than it is in surrounding communities. Vaccine is everything. And as I said earlier, we are not dealing with the same virus that we were dealing with at the beginning of this pandemic. The symptoms are more severe. So again, I can't stress this enough. Get out, get vaccinated. Even an average healthy young adult can have some very severe impacts from these strains. Next slide, please. And that, you know, my statement about people being most impacted by this slide here again says it all. We've got a lot more work to do in our Hispanic and Latino community. You can see that a much smaller percentage of the population and yet a very high percentage of cases. And the outcomes from that are more severe, and you'll see that on the next slide. Take a look again, about 30% of the population, 40% of the cases, and 30% of the deaths that we've seen in Denver. And again, we're dealing with more severe strains now. So I cannot say this enough. If you think that you could withstand the effects of this virus, if you thought it's nothing more than a cold, if you thought that it's nothing more than the flu, you are mistaken. And it's important to get out and get vaccinated. These vaccines, Johnson & Johnson included, Pfizer and Moderna, are 100% effective in preventing death from COVID-19. 100% effective. If you had a choice between a small percentage of running the risk of severe complications or death or 100% coverage, I think the answer is very clear. Get vaccinated. Next slide, please. We have some face covering orders that we'll be revising here, giving case numbers. Again, we are pulling out of the pandemic. We will largely align with the state's face covering order at this point. Again, it's no longer required in an outdoor setting. If you're going to a large events and outdoor settings, we still would encourage you to wear it. It's just added precaution, but it's no longer mandatory. The state's public health order with respect to face coverings now allows for people to lift it in certain settings. If in that setting, a responsible party can demonstrate that 80% of the people in that setting have been vaccinated, it's 85% with restaurant settings. So if 85% of employees in a restaurant setting can demonstrate that they've been vaccinated, then those face coverings can come off. I would encourage managers of those venues to ask employees. It's not required. They can offer that information. They're not required to. But if you can demonstrate that and they can confirm it, then again, face coverings can come off. We will align with that here in Denver with a few exceptions where we know it's really going to be impossible to demonstrate that 80% of people in various settings are vaccinated, where the population in that setting is very transient, people coming and go in grocery stores, large retail outlets. It's just not time yet for that allowance. So we'll keep face coverings in place for a little while longer, even in those settings. Next slide, please. Okay, thank you. With that, I would like to turn it over to Denver's clerk and recorder, Paul Lopez, who has some thoughts he'd like to share. So thank you.
Thank you, Bob. Thank you, Mayor. How are you, Denver? I'm Paul Lopez. I'm the clerk and recorder for this city. I believe I had COVID, and it was the beginning of the year when we had our first primary election, which, by the way, you should register to vote, denvervotes.org. Make sure you do that. It's never too early. I happen to be one of the lucky ones to get through it. But I can tell you that as a father, my life flashed before my eyes. My duty, my responsibility as a father to my young daughter is to be alive so that I can take care of her. To be alive so she has somebody there to walk her across the stage when she graduates or when she continues from middle school in about a month. I'm asking you to do the same thing. Think about that vaccination, not just for yourself, but for your community, for your family, the people who care about you, the people who depend on you, your community, our city. We're doing well, as people are saying, and you're seeing the data, but we're not going to do well if we give up now. Yes, we can deal with a little bit of a headache. We can deal with the aches and pains and the sore arm. We're tough. They built us tough. We can do that. We're from Colorado. We have thin air. What I'm asking you is to take that vaccine, because there are a lot of folks that may not make it. And you never know when one of those folks are one of your family members, one of our family members, one of us. I just remember some words that my daughter shared with me. And I told her I got my vaccines, had my sore arm, had my headache. And she said, "Daddy, I don't want to get sick." That's why you need to take this vaccine, because I know there's also daddies out there that shouldn't be getting sick, and mommies. So please share that responsibility with each other. Keep each other in check. Make sure that we're getting that vaccine so we can start again. Voy a decir algo en español también, para que los están poniendo atención en español. Es nuestro papel, como hombres aquí en nuestra comunidad latina, como mujeres fuertes aquí en nuestra comunidad latina, tomar la vacuna, vacúnase. Es importante para nosotros, para nuestra familia, para nuestros hijos y para las personas que nosotros también tenemos mucho respeto y amor por, nuestra familia, nuestra comunidad. Sí va a doler, vas a tener un dolor de cabeza, o va a doler su brazo, pero no es como la muerte. No es el dolor de la muerte. Y es súper importante que nosotros todos vayamos a agarrar estas vacunas. Gracias a ustedes, Denver. Thank you. And I'm turning it over to my brother over here, Nelson. Nelson's looking sharp. Yeah.
Hi, my name is Nelson Caballeros. I just want to share my experience with COVID. On Friday, January 15th, I got COVID. I lost my taste, I lost my smell, and because of that, I couldn't eat for 10 days. I tried, but my body just rejected everything. It was something weird. But since I didn't eat for 10 days, my body was getting weaker. And as I was getting weak, the virus was getting strong and was taking over. I couldn't fight it anymore. On that Sunday, paramedics came to my house to check on me because I called them. And they took my vitals and they told me, what do you expect from us? Because your vitals are good, the hospital is not going to take you. So I thought everything was normal, no? Between that Sunday and Tuesday, my body was giving up more and more and more and more. I stay home, still no food. On that day, I received a call from Denver Health. There's a program that checks on you once you test positive. The nurse that called me, I couldn't talk to her, so she told me that there was another nurse named Flor who was going to call me back in 5 minutes. 5 minutes later, Flor called me, and as we're trying to have a conversation, she couldn't understand what I was saying, and she said, Nelson, I'm going to go to your house. I remember that Tuesday was a very snowy day, and she still, 30 minutes later, she was in my house. She took my vitals, and she sent me to the hospital. She didn't doubt about it. If I don't receive that call on that Tuesday, if Flor doesn't step up and go to my house and sends me to the hospital, I wouldn't be here. COVID is something, like everybody's saying, is different. It's not just a flu. I thank God for that program that checks on every single person that tests positive. The nurses that are doing their job right, by making those phone calls, by going the extra mile. I decided today to share my personal experience to encourage people to get vaccinated and follow all the instructions that the health department is giving us. This is not a joke. COVID-19 changed my life. I can tell you my life is before COVID and after COVID. I can sleep good. I have no energy. I can be doing something normal and then suddenly it's like your phone just lost the whole power. That's how I feel, and it's time to go to bed. There is no other way. I have headaches that I didn't experience before. I used to hike. I used to walk a lot, do a lot of exercise. I can't anymore, but I'm sure one day. And one day, because there is hope with those vaccines. Once you vaccinate yourself, you're giving yourself a chance to survive, a chance to live. Like my fellow friends over here said, do it for your family. Do it for you. I did it for myself. I did it for my 4.5-year-old granddaughter. I want to make sure our grandpa is there for her and can show her all the beautiful places in Colorado. And I want to thank God for this opportunity to be here. I don't know what his plan is, but I'm sure it's a good one. And I encourage everybody to do it, please. Do it for you, for your family, for your friends, for your neighbors, for the people at church. That way we can go back to normal. Thank you.
I want to thank Nelson and, of course, our clerk, Paul Lopez, for their stories and for urging folks to get vaccinated. Before we go to Q&A, we're going to have a report from Britta Fisher, our Chief Housing Officer and Executive Director of Housing Stability, to give an update on taking care of our unhoused neighbors during the COVID.
Thank you, Mayor, and good morning. Housing stability is a key focus for the City and County of Denver. This was true prior to the pandemic's onset, and COVID-19 has only exacerbated community needs. It's been leaving thousands with reduced income and at higher risk for homelessness and housing instability. The Department of Housing Stability, or HOST, has worked tirelessly throughout the pandemic alongside our partners to keep people in their homes, to provide temporary shelter, and to resolve homelessness for individuals and families. As we passed the one-year milestone of COVID-19 in our community, we took a step back and assessed our housing and homelessness outcomes, which are published in a summary report available on the city website. The numbers speak volumes. Our city shelter network now accommodates upwards of 2,200 people nightly. That is a 60% increase over the pre-pandemic demand that we had. We are serving nearly 1,000 more people in our shelters each night. All told, more than 12,500 unique households have been served through shelter and services. Our host partners helped more than 1,000 households regain and maintain permanent housing upon leaving shelter, outreach, or rehousing programs. And we provided rent and utility assistance to 2,500 households, a steep increase and a needed lifeline to keep folks in their homes. With many partners, we have risen to this occasion and have brought resources to bear. I want to publicly commend the shelter workers, the outreach workers, who showed up every day of this pandemic, as well as the National Guard members who assisted us while we staffed up to meet this new level of facilities and demand. Our work is by no means done, and many more people are experiencing housing crisis. At the Department of Housing Stability, we will continue to work with a multitude of public and private partners to promote housing stability and to help ensure that episodes of homelessness are rare, brief, and one-time. Earlier this morning, alongside Congresswoman Diana DeGette and the Mayor of Denver, we were in Northeast Denver to announce a vision to purchase and convert a 95-room hotel into shelter, and then subsequently housing. We're very thankful to have Congresswoman DeGette's advocating for federal funds needed to make this possible. If this is approved, our plan is to offer shelter at the site for about 2 years with a conversion to supportive housing units. As a city, we are gaining momentum in better serving people who are facing a mental health crisis. And in the coming weeks, Denver Department of Public Health and Environment, led by Bob McDonald, will be opening a new 46-bed crisis stabilization center. This will provide 2 levels of care for people experiencing mental health crisis, including emergency services and short-term transitional housing. Many of the clients of the new Solution Center will be our unhoused neighbors. And our shelter network continues to evolve. Later this summer, Host will open Denver's newest shelter. We have been busy renovating 82,000 square feet at 4600 East 48th Avenue into a new shelter. And with our shelter partners, we're preparing for a 450-bed facility with social distancing requirements and with navigation to services to connect individuals with housing stability. I want to thank our many partners. I want to thank our city council and our mayor for being strong leaders to support our unhoused neighbors. And I want to thank you, our residents of Denver, who care about our unhoused neighbors and how we can help support them with housing stability. Thank you to the voters who passed 2B, our homelessness resolution fund. We are putting those dollars to work right now to provide this 24/7 shelter and make things like this new motel turn into the shelter and housing of the future. We will continue to support programs, policies, and investments to meet the needs of our community. Thank you very much.
Thank you, Bretta, and to Bob as well, and to Nelson, and again, Clerk and Recorder for being here. We'll open it now for question and answer, and we'll have everyone available to answer questions.
Alrighty, Katie from 9 News, do you have any questions?
Yep, I do.
Go ahead. Go ahead, Katie.
Yeah, Mayor Hancock, to get to that 80 or 85% of people vaccinated inside, what's deemed an acceptable way of demonstrating you're vaccinated? Should businesses?
I want to make sure I understand your question. What's an acceptable way of what?
Can you repeat
Oh,
your
sorry,
question?
I'm on a delay, so, yeah. To get to that 80 or 85% vaccinated inside, what seems an acceptable way of demonstrating you're vaccinated? And should businesses take people's word for it, or must they see some kind of proof?
Yeah, I'm going to ask Bob McDonald to share his thoughts.
So in the state's face covering order, and in Denver's as well, there will be a requirement to show proof. Again, managers can ask if they want to pursue that allowance, that 80% allowance. So they can ask for vaccine documentation. If a person demonstrates that with their vaccination card, which everybody receives when they've been vaccinated, you can get that, or other forms of documentation that you've been vaccinated. You can provide that, and that would be acceptable. And again, if 80% of people in a work setting do that, then face coverings can be lifted.
This morning, Katie, I was at the presser that Britta referred to with Congresswoman DeGette, and after we were finished, a couple of constituents came up and asked if I would take a picture with them. And as they approached me, they said, "We want you to know we've been vaccinated." And so every one of us carries these cards to demonstrate that we've been vaccinated. And we encourage people to do that. So when you walk in, if you happen to be asked, as we try to demonstrate 80%, this is a great way, as Bob alluded to demonstrate your vaccination.
All right, Dave Sachs? You may need to press *6 to unmute yourself. Anybody else on the line want to ask a question? Go for it.
Thank you. You know what? That was my question, and
Alrighty. Looks like he dropped off.
Okay?
Alrighty, anyone else on the line? Or Katie, did you have a follow-up?
All set, thank you.
Alrighty.
All right. Thank you all very much. And let's, please, the message we want everyone to walk away with here is that we are almost there. And I want to remind everyone the goal that we laid out. Join us in helping to get 60% of all Denver residents vaccinated with 1 dose by June 1st and 70% by July 1st, beating the national goal by 3 days. And again, we're excited about the possibility that Pfizer will be able to offer vaccine to 12 and 15-year-olds or to 15-year-olds hopefully next week. That will help us meet the goal. But as we heard from Nelson and Clerk Lopez, we don't get this, we don't attain these goals if we don't get folks in these areas of our community who've been hesitant and concerned about taking the vaccine. It's safe, it's free, and right now you don't even need an appointment. You can walk up and get the vaccination. So please do yourselves, do your family, and do your community a favor by getting